Let's talk about motor speech disorders. We talked already about children who have motor difficulty, meaning they have sound distortions. Maybe they have a distortion of R, perhaps they have a lisp. They have difficulty placing their articulators in the correct spot in order to produce sounds accurately. Some children have motor speech disorders that are neurologically based. Notice the difference there between difficulty versus disorder. Children who have motor speech disorders may have childhood apraxia of speech, or they may have dysarthria. Let's talk CAS, childhood apraxia of speech, first. Those children who have this neurologically based SSD have difficulty with the planning and programming. So remember those two words, planning and programming, which both begin with a P. Apraxia has a P in it. These children have difficulty with the planning and programming. So they're sending the message from their brain to their articulators. It's not a weakness issue. It's not an issue with their muscles. They have difficulty with the movement from sound to sound. And ASHA, the American Speech Language Hearing Association, way back in 2007 said, hey, we have some consensus. We have some agreement that children with childhood apraxia of speech often present with these three characteristics. Now, this is not a checklist. Every child with CAS doesn't have to have every single one of these, but oftentimes you will see these characteristics in children with CAS. The first, these children have inconsistent productions of consonants and vowels, meaning they might have a word and they say it incorrectly, and then they try it again and they still say it incorrectly, but it's a different production. It's not a pattern of error. It's not like those kids who say top for stop and they always say top for stop or T for key. It's not a pattern of error. It's oftentimes inconsistent. They may also have some of those patterns, side note, PS, but they often have inconsistent productions. Number two, lengthened or disrupted co-articulatory transitions. What does that even mean? That means that as they're trying to sequence from sound to sound, oftentimes it may be stretched out. It's difficult for them to place those sounds together. So it's disrupted or lengthened. It's hard for them to move their articulators and to sequence those sounds. And because of that, they have difficulty with number three, which is prosody. What's prosody? Well, it's that nice rise and fall that makes our speech sound interesting. Oftentimes these kids talk slowly, they talk monotone because it's difficult for them to place those sounds together, to sequence them together in a way that results in smooth speech that has that nice rise and fall, all right? Children may also have additional characteristics. Oftentimes they have voicing errors, they have vowel errors, they might be groping or trying to reach their articulators. Their tongue might be kind of bouncing around trying to reach for that articulatory contact because it's difficult for them to plan and program exactly where their articulators need to go in order to sequence those sounds.